Okay, so good evening, and here we are on our, what do you call it when you come to the end of something? I don't know. Anyway, the conclusion, last treatment that I'm going to do with Kelly. Just a bit of a recap. This is the fourth treatment. We've been working. Let me adjust the camera. We've been working on a shoulder injury and pain that had been across the top of the trapezius. We've been working on initially pain in the lower back, SI joint dysfunction, and talking to Kelly earlier, she just arrived, and just getting some feedback from last week's treatment. It looks like things have improved a lot, and the freedom of her range of movement with her swimming, crawl seems a lot easier and better, which is a good, huge thing for me, because I was a bit lost last week. I went away from the treatment feeling unsure whether or not we'd shifted stuff. And it's interesting, isn't it, that somehow you've got to keep hold of what you believe in and know that fascial work does actually work. So here we are tonight. So swimming feels like it's improved a lot. Yeah, it's got a lot better, which is great. I'm going to go back to basics. I'm going to look at the Gilliatt's test again and just check SI joint and just see where dysfunction is there. Range of movement, as always, go by that. I think I've got in my head, when I thought about this evening, I want to do a little bit more work. And actually, when we finished last week and came off camera, I did a little bit of work on Kelly's hip flexors and psoas particularly. And I'd quite like maybe to do a bit of that tonight. The problem you've got with swimming is that you've got this complete cross balance between kicking and crawl, and that diagonal relationship between the pelvis, legs, bicep femoris, lats, shoulder. That triangular kind of diagonal fascial link is a powerful one, and gets easily fatigued. So although we've sorted the shoulder out to an extent, and even though the pain feels like it's far more manageable, I think it's really important to sort of think about where's the end of this chain, what's happening with the glutes, hamstrings. So I'm going to play with that a bit, but let's start with the Gilliatt's test and just check where we are. If I ask Kelly, just come through again. Again, I'll fiddle around with the camera so we get a good view here, so we can see what we do. Okay, just popping your top off, Kelly. You got your sports bar on. Brilliant. Fantastic. Okay, so Gilliatt's test as always. Hands on the iliac crest. Come down. Find the PSISs and sacrum. Just sit on this side. I'm going to do the other one actually, because it was the left side that moves well. So just lift that. Are you okay with that? Just lift that knee up. Brilliant. And come up high, and then back down again. And again for me. Just come up. Yeah, that's fine. And then we come across to the right side. Yeah, that's moving quite well. Don't seem to see any difference in movement there, which is nice to see. I'm going to ask Kelly, just aware of the camera and the light. So maybe, can I just bring you over this way a little bit, and then we'll just jiggle the light a little bit. I don't know if that's any better. No, is the answer. Let's come over this way. I just want to get a bit of light on your back. That's better. And so we can get the camera. So let's just see forward flexion. Just go down, take your chin down and just hang over. Yeah. Okay, so we still got that tightness down this left spine. Any discomfort through here, Kelly? A little bit on. Yeah. You feel it pulling more on the left side still? Yeah. And come down again. Just come down. Just cool down. Yeah. So I can still see that left spine group here. Just a bit more built up on that left side again. Okay, and then I think we did side flexion, but I'm pretty sure side flexion is going to be nice and comfy for you. Yeah, and then the other one. Any discomfort through there? No. Lower back pain generally. I mean, the last time when we first did this, there was a sort of a 2-3 lower back, reasonably most of the time.
Again, I feel like sometimes there is a slight bit through my left, but it's not like constant.
Okay, so day-to-day pain in the lower back, much better. A little bit of pain, possibly. I'm repeating a little bit about what Kelly's saying, because of I'm the person with the mic, and I don't want that to be lost in the discussion. So a little bit of pain coming down this left glutes kind of area. Okay. Okay, let's get you lying on the couch. Just going to turn this around now so we can just drop that onto the couch. I'll move that around accordingly. Just lay on your back to start with, please, Kelly. And if you're okay, I'm just going to cover up here. I've got to be very cautious of my towel management this week. And looking on just the pelvis, it's going to be just seeing, by sitting on the, just a rocking of the pelvis here, just see where that, yeah, you've got the good side. So looking on top, ASIS, looking underneath them, definitely some sort of feel like there's a bit of rotation there, a little bit. This one's down, rocking backwards and forwards. I'm just going to push into this one here and just get a sense of that down onto the couch. Does that feel easier, smooth compared to this one where I'm pushing down onto the couch? How far can I go? Does this one go further compared to that one? What's the comparison? Pretty good, actually, isn't it? It feels pretty, it doesn't feel, no, this one was tighter, wasn't it? The right one's always been that little bit, although I don't feel like I can go quite so far. This one, I'm going back onto the deck, pretty good. This one feels, tend to hit the door a little bit earlier. This one, not much in it, is there? Not much in it, but a little bit more when depressing this right side. Simple hamstrings, but I'm pretty sure Kelly is nice here. How's that feel? It's a bit tight. Let's just compare that to the other one. Yeah, tighter on the right. Okay, I'm just going to do some adduction. Just come out this way. Okay, so get a feel of that. Yeah, nothing. Okay. So let's do hamstrings and do bicep femoris. So I'm going to come across this way. Yeah. And then this one. That's okay. So let's do the bicep femoris on this one. Right, and this one. Okay. So the both lateral hamstrings being the tighter of the tighter of the hamstrings. Retain our sense of humour tonight. Just looking again at the shoulders and just a general sort of sense of protraction. And always with this stuff is always, where do we start our treatment tonight? Where do we kick off? Where do we start thinking, yeah, that's the one I'm going to start on. That makes sense to me. I can see why I'm starting there. That's always the challenge, especially when you've got this kind of, actually, I'm feeling a lot better. Protracted on that right side, quite noticeably. Here, this one's certainly more elevated. So I think that's where we're going to kick off. I want to kind of hear. It's fascinating, isn't it? It's really interesting, the relationship between this right shoulder, this glute, spine down on that, erector spinae down on the left side, both hamstrings, this hamstring tighter. Now, let's kick off on that. Let's kick off there. Okay to pop your shoulders out. Let's just pop a bolster on there. Yeah. Is that all right? So I'm going to use, I'm getting good at this kind of product. This is what I'm using this evening. Oh, let me just come down so you can see. Oh, there you go. So shea butter, I'm a bit of a fan. I like it. This one doesn't smell like peanut butter, which is a bit of a shame. But interesting. I've been teaching today level 3, and the discussion always comes up about, you know, with the effleurage and the kneading and the ringing and the warming moves that we use before we get into deeper work, and how long do we spend our time kind of warming up and getting tissue kind of warm before we do deeper work. And you know, the whole purpose of these kind of Zoom meetings and I don't know, sharing and being able to play at this level, I think is about sort of real life rather than the skills that we obviously grow and learn to give us confidence and to allow us to, you know, work through that kind of confidence of going for the exam. And it's certainly, I would say that my warm-up moves, have I warmed up Kelly's shoulder here? Have I done effleurage and kneading and ringing? And no, I haven't. I've gone straight pretty well slowly into, you know, the pressure's sort of fairly gentle, but concerned about the tissue and working with the tissue. But am I going to spend a lot of time kneading and more? No, I'm going to spend my time just slowly increasing the pressure and getting to a point where I feel that, you know, the tissue is being worked with. So do I spend my time warming up? No. But I don't work in a fast pace. So the whole thing is slowed down. And the tissue is worked on by kind of gently and people that have watched a few of these Zooms will know the phrase I keep bubbling on about is kind of having a conversation with the tissue rather than it feeling done to. So I you know, given that Kelly, you know, yep, she's warm, she's alive and she's warm, and that's good enough for me. So I'm just going to come in, and I've decided to work on this left one first. Don't know, just felt like the right place to start. And using this kind of blade of the, I've been talking today about this blade of the Iona here, and just being able to use this as a great, just an amazing tool. And I was kind of in my head, I've got it as a blade, and it just does some amazing, you know, when thought through and carefully used, it's just amazing and can really kind of create some change. So I'm just going to pull this through here and just, as always, thinking about anterior deltoid, but and that coracoid process attachment to pec minor. Is that okay? Not too much. It's okay, isn't it? It's firm. Just drop into the tissue here and just going to do a bit of sideline on that in a minute, but immediately now just come across to the other side and I've got to show you this, guy. This is really important. This is Mark doing his exercises on his toes, and anybody who can do that is worth a beer or two in my mind. Thank you, Mark. So we just come back to this, but that seemed like an important thing to show. Mark won't forgive me for that. Sort of more solid this side, isn't it? You feel it, don't you? You can feel the sort of rigidity in it and tightness on this side. Just gonna move that a little bit because I'm heading my way. Yep. Cool. Actually, I'm going to stand where the camera is and drop more into that view. I like this position. I kind of lean on the couch, and the my ulnar blade just sits back, and I can use my body weight to just slowly come down and strip through that anterior deltoid and then obviously down the bicep and stuff, and it's just works really nicely, and the control is absolute. You know, you don't. It's not a kind of a horrible elbowy kind of aggressive move by any means. It's a really kind of careful. I can drop on things, slow down. What I want you to do is just lift your elbow off the couch and then back down again, and then flex your shoulder and then back down again. Lovely. I'll just come back again and just lift that arm again and then back down. Lovely. So again, that whole stuff we were doing last week, flexing and then relaxing, engaging the muscle fibers and then switching off, and that lovely kind of getting the receptors to sort of engage and then release. And then while you're working on it, it works so nicely and so effectively. I'm going to drop down and come right through on this arm. Sorry, you've got my ear hole in your camera view. That's better. So time, and then come through here, all the way through. How's that feel? Is that all right? Sore or? Yeah, if you get through there, can't you? You can just get that. Okay, that feels nice. It's still, yeah. Sorry, Kelly, we're going to have to look at maintenance, aren't we, at some point or other? How do you keep into a place where you don't get quite so fatigued and it's okay. Oh, sorry. Just checking what the camera's doing. Okay, so. Feel that. So breath in, and then your shoulder drop. Good. Okay. No. Saw through your tricep. It's nice. It's looking nice. Yeah. So notice that now it's nice and soft rather than being kind of all hard and solid in there. It feels nice. Oh, just going to grab myself a chair. So, and just like a bit like I did last time, really. I really like the model of having a nibble and then going away. I think the body likes it. I think rather than feeling, oh, I'm going to do your neck now and just crash on with it, I think it works really well to just have a little bit of a nibble. And so spinous processes up into touching C2, come across and just feel those small top extensors of the neck right at the top there. Yeah, nice. And then drop down through that gully. It feels okay, actually, doesn't it? Doesn't feel imbalanced particularly. I feel quite kind about that. Feels all right. Just remind ourselves about finding scalenes. So we just lift Kelly's neck off there just a little bit. It gives me sternocleidomastoid, that nice, and I can drop in behind, just drop back. And that gives me that thoracic triangle, which is what we need to find. Just want to just have a little feeling here and just see what the scalenes are like today. How does that feel? It's okay, actually, isn't it? So if you just, I'm going to just hold there for a minute. You just rotate your head, keep your head on the couch and rotate. How does that feel? And the other way? Tighter to the left? Yeah, okay. I'll come back to that. We'll come back to the neck, I think. Remind me to do your scalenes. Gonna have you on this side. And down the couch a bit, please, Kelly, just so you're plenty on the couch. Let me just cover that. Brilliant, thank you. Just going to bring the camera, see if I can come right over the top there and get Pec Major in here. I'm just going to just come a little bit that way so you're on your side. I'll rock over that way. Knees together. Do you want the pillow between your knees? Or?
Oh, no.
You okay?
Yeah.
Come in here. I'm going to undo the. So just that some of that sort of right. The lats work. So yep, okay then. Happy for me to peel that off. Perfect. Thank you. And then sideline. Perfect. Just get the positioning there. That looks quite good. I like that. Just want to bring this on if we can. Just pop that over the front of you. Just like that. Perfect. Thank you. Where I haven't done any work on the back at all so far, I just wanted to get into really just that pec minor. And then I thought, well, let's just do some sideline here on the lats before we pull across to the left side. But I think I might have you on your tummy to do a bit more of that work. But I wanted to come into the working on that pec minor from this anterior surface. So I'm going to drop in here and come into this aspect here. A little bit of wax on my hand, just into this. I just want to make sure you can see that well on the camera, really, so you can get a view of it. It's a nice move, this, and quite tricky to do, and it requires, so hand on the scapula and his shoulder blade, the client's hand needs to sort of relax here, and here's pec major, and we're coming down underneath it, and that's what we're doing. So coracoid process here, so we know that pec minor comes through here, and we're kind of coming, the idea is that we come underneath pec major and then curl our fingers in to work on pec minor. So that's our thinking. So we can come through here, and it requires the client to sort of let you have her arm, his arm. And I tend to start by moving the scapula around a bit. So I'm moving the scapula up and down. And of course, if I want to stretch pec minor, I can just pull back and you can feel it fire across your fingers. So you kind of just gently work your way in. Fingernails, as always, are a real no-no. So no fingernails here, otherwise you really kind of hurt your client. And then you kind of lift up and take a breath in for us, Kelly. And as she breathes out, you can just let the shoulder just drop and just relax. And then gradually you drop your fingers in to feel those fibers. And if you're protracted, this is flipping sore. And you can feel quite stabbed. It's quite a stabbing, sharp pain, isn't it? That really is unpleasant. And you've got to just stay with that trigger point, rocking backwards, just gently. My fingers moving just 2 or 3 millimeters really along the fibers, allowing it to just quietly and gently release. In this new crazy planet that we live in, where we can't see people's faces very well, we have to become expert at reading eyes, don't we? We have to look at, I have to look at Kelly's eyes and decide whether or not she's had enough. It's starting to go now. Start to break off a bit, not quite so sorry. So nice slow breath in again, and this time just release, and I'll just come in. Obviously, if you're working with a lady on this, this is so important to get right in terms of breast tissue and making the person feel safe. And I do all that, you know, Kelly's in charge of that. I'm not going to try and manage that for all the obvious reasons. And it works well. I've never had a situation where you feel you're compromised or somebody feels kind of, you know, embarrassed. It doesn't, you know, that's feeling better, isn't it? That's starting. I'm going to come up further and then dropping back and then move around, be kind of, yeah. And this move can feel, you know, afterwards, the client can feel quite sore on the pec minor and a bit bruised and a bit kind of, yeah, thanks for that, Chris, kind of feel to it. So, oops, sorry. Of course, when you're on it, you can move the scapula and then it pings off. And it's a bit like letting an elastic band go. It can really feel quite kind of, you know, the client can feel quite alarmed at being pinged. I think that's all right, actually, yeah. Not sure Kelly's going to feel too great about this. Right. And then obviously you've got that kind of nail kind of mark on the skin. So just make the client aware of that rather than try and hide it. Seems to be the best plan. MET, I'm going to just pop it a bit in the back here. So let me just move the camera around again. So you can see the, you know, classic MET stuff. Here's the inferior angle of the scapula, holding onto the ribs quite nice and firm, pulling back on pec minor. So I'm going to just pull back on pec minor here, pulling it back. Ask Kelly to push her fingers into my hand so she's engaging. 5 to 10 seconds. And then relax, take a nice breath in and just pull back. And just get that stretch back into stretch. Yeah, feel it all right? Can do it one more time, so just engage. And then relax and then just pull back. Cool. Okay. Right, let's do your bra this time. Okay, so let's just pull you back. What I want now, Kelly, is just for you to move onto your front, please. So just pull back. I'll take the pillow out of the way for you. Perfect. Do you want a pillow on the forehead? Are you okay? Yeah, sure. I don't know if this is the same colour sarong as we had last time. I think I've got a feeling it is. All right. Okay. So I want to include some glute work as well. So it might. I can ask you to pull your shorts down like you did last week. I don't know if they can I ask you to do that. Fantastic. Thank you. And then drop the arms off to the side for me, please, Kenny. This feels so much better, isn't it? Tissue feels kinder, it feels softer, feels far more workable and able to be kind of engaged with, which is really nice sort of feel to it. You know, it doesn't feel angry anymore, you know, that kind of, you feel that the tissue, yeah, tighter on this left side, yeah? Sorry? You can feel it more on the left, yeah, okay. So I'm going to do some straightforward work here on the left glute. Tender. Yeah, so I really want to think about, can I just take a little bit of wax off there? I want it to be a little bit drier. And coming down with my forearm there. How's that? Is it 1, 2s and 3s? Where are we there? Yeah. If I come down, does that increase or? Not really. Cool. So I'm going to work on the chain right through at the lower back here. I'm going to push through here. I'm just working on spinae really at the moment. A little bit on the infraspinatus and posterior deltoid stuff. A little bit. But I'm interested in the sacrotuberous ligament right through the sacrum here and down onto, I'm going to just work on glutes. I want to just see the edge of the sacrum here, this edge here. I'm just going to work on that in terms of glute max. How does that feel, okay? Yeah. I'll take your shorts down a bit so the Kelly, that's all right. So, really finding my way through ischial tuberosity, coccyx, coming into the, I'm going to do it on this way. How does that feel? Let's just do that from the other side for see. I think it gives me a bit easier. So sacrotuberous ligament, coccyx, ischial tuberosity, line between the two, and then you can just drop in there and just feel that edge of that sacrum, edge of the sort of sacrotuberous ligament. Is that a 2? Just going to hold that for a second to just release that. So the question I think is always with this, with Kelly, is that she's got this overuse or had this overuse sense of her shoulder, left shoulder, and how do we stop it coming back? And what's the kind of fascial chain along that's giving her that rotational issue? Is it poor shape and a swimming, or is it something else that's kind of something that just hasn't been addressed? Don't know. So we can feel easier. So come across to the other side. I'll do both while we're here. Let's go tuberosity, coccyx, drop in. So what's this one like? Slightly more tender. That would link with your right hamstring being slightly tighter. Okay. So I just keep thinking to myself that actually I just want to make sure that this left shoulder is going to remain stable, and just working on the that lateral border of the scapula down the tricep. Well, that feels so much better than it did before. I'm aware of time, and we've got sort of 20 minutes to Mash out a couple of hamstrings, which I guess I think we could probably do. Feels all right, doesn't it? Okay. All the way up here. Do your bra. I'm just going to do the other glute just quickly before we get too engaged with the hamstrings. Oh, glute med. How's that? Lovely. So glute med tight. How does that compare to the other side? Can in through here? Yeah. Too much? It's always nice that you taste, you can like, is that too much? And they say, no, it's not pleasant. It's an interesting adjective, isn't it? Not pleasant. It could be anything from a slight drizzle or pouring rain. It's just not pleasant. Coming onto the edge of the sacrum. Yeah. So that nibbling away of that glute max and glute med is so important. When we trigger off that glute med, go through to glute med min as well. Really nice to do. Probably quite nice to do this sideline. I think maybe a bit more access to it sideline, but I'm conscious about time, and I'm conscious about, like always with our treatments is, gosh, we've got this limited amount of time. How are we going to make sure that we kind of cover it all, and make sure that we do enough to, try and correct the pattern of what we do. And people I've trained with and listened to and watched and do, and, they talk about, don't try and rush this, come back and get the series of treatments in, and don't try and kind of complete something that needs time to complete. So, and that's a very fair kind of observation, I suppose. I don't know what to do now, Kelly. I've got to pull your shorts up, and are you able to help? Brilliant. Never help somebody pull their shorts up. I think it's tail management's a bit better this week, I think. We had a few whoopsies last week, which mildly embarrassing, but I think we're okay. We were all right. We've kind of survived the event, and Kelly's come back again, and well, yeah, I think we're okay. I think we're all right. We'll talk about it another time. I'm going to focus on bicep femoris because the range of movement for the medial borders, medial hamstrings was fine. I'm going to do two different moves here. I'm going to work just this one, just directly. and then I'm going to turn her over, and I want to kind of get her knee up onto her chest and work more on the this ischial tuberosity aspect of it. But I just, you know, start the process by coming up. And I think with all hamstrings, calves, really important to come down the leg as well. You know, we're taught, aren't we, in traditional massage, that all massage moves must be up the leg and must be kind of towards the heart. And sure, I think that's a good model and, you know, advisable. But in terms of fascia, of course, that runs in all directions. And who's going to distinguish one from the other? And you know, so I would encourage people to always, you know, come from that ischial tuberosity, drop in and work our way down, as well as up. I'm aware of kind of, it feels easier actually. How are you feeling, Kenny? Are they sore? Yeah, in here, isn't it? This lower portion here. Well, you know, this third of the way, let's just go through the anatomy of this. Head of the fibula being the attachment point. The surface one here is bicep femoris long head, comes up to the ischial tuberosity. Oh, hang on a minute, we've got no camera down here. How can I possibly talk to you about hamstrings although we haven't got a camera? Dear me, that's not good, is it? Right, let's do this. That's better. Right, so ischial tuberosity attachment site. Head of the fibula being the long head as it comes through. And if we come up just behind, you can feel the long head. And if you get the client just to engage, you can feel the tendon for the long head, and you can feel the tendon as it comes across to the head of the fibula. If you come in just behind it, about a third of the way up the leg is the short head. And you can come in here, and it's quite nice one to work on. It's quite responsible and very involved with the rotation of the lower leg. So this rotation here is yeah, short head is involved, but nice to do. And so you're just tucking underneath the tendon, and width of a thumb. I'm just using my thumb as a guide there, really. You know, those two fingers work really nicely in this area. And, you know, as always, that stripping of the fascia, you know, across the fibers is just feels so lovely for the client, and is really beneficial as we sort of strip through the fascia. And then we can drop in with our forearm again and fist down. I'm going to finish by doing a bit more when Kelly's laying on her back with the hamming. So let's just pop over and do this one. Interesting, this feels different. Would you agree? So this one, less angry. Just fascinating, isn't it, to go with your instincts and to let your treatment be organic. It's going to do range of movement here. If I'm, can you see that? Yeah. So if I'm pushed out to the side when I do this, gives me a good indication about perineals. Kelly's good. That feels all quite nice. So just my hypothesis has just again gone down the toilet. So never mind. And again, just that lovely working down, chopping in. hardly anything on this one, isn't it? Do you think? It doesn't. Yeah, would you agree? It feels nice, doesn't it? Feels tidy. So I'm going to stop doing that one because I don't see much point. But I am going to do a bit of work on the perineals on this side. Not much, but just to sort of say hello to them, really. So perineals, bony landmark, malleolus, head of the fibula, you know, longus, brevis, onto the base of the big, small toe. Just pop that back up so you can see. Base of the big toe, you know, base of the little toe for brevis, and then longus coming round, base of the big toe. So plantarflexors and everters. Why am I doing this? Well, I wanted to just follow the chain from left side, lats, left side erector spinae, right side glute, sacral tuberous ligament, sacral tuberous ligament, bicep femoris, head of the fibula, and then down the side here. The range of movement is pretty good. I'm not getting pushed out at all, so I think we're clean. But I don't know, just felt why not? You know, why not just spend a little bit of time down this edge here, and so I just go into dorsiflex position, and then as I come up, just go into plantarflex, just gently, slowly, yeah, and then back again, come back down again, and then yeah, off you go. Just take it in a long, yeah, shortening, and then the opposites, and then plantarflex, and then as I come up, dorsiflex, yeah, and then, yeah, great, great, yeah, lovely, good. Move. I want to just complete. Where are we with time? We've got about 10 minutes, I guess. Nearly 8 o'clock. Just want to just complete a rotational bit of stretching on Kelly's lower back. I think it's fine. I think the spine are clean and tidy here. They don't seem to. I don't know, but I don't know. Just found myself thinking this could be a nice move to do. So the legs are bent and got hold of. So I'm holding the legs together, and by rocking the legs over, I get a rotation in the pelvis. So you can see that lifting here, which gives me a nice kind of bit of work to get into here. So I come across with my blade on the top of my honor, and as I come up, I can just swing back. So I stick my bum out basically. When I come down, I just stick my bum up, and that lifts the pelvis. And I just, yeah, and I just want to kind of work on some of that fascia there and pull up. How does that feel? Nice. It's interesting, isn't it, when you kind of you have a series of treatments you want to do, and it's quite interesting to sort of play around. You do a little bit here and a little bit there, a little bit here, a little bit there, and you allow those movements to sort of come together. Just remembering a little bit. Teddy's kind of. This feels so much better here, doesn't it? Gosh, it's just a different person, isn't it? Yeah, a lot more even. Yeah, definitely. And levator, not so angry. Upper trap. I think what's quite nice, and when you know, when we talk to our clients about, oh well, you're a runner, so if you have an injury of a calf, you've got to stop running. You know, when Kelly came in with his shoulder, and there was this kind of you know, serious kind of discomfort and spine here, very tight on the left side, right shoulder. No, left shoulder really sore here, wasn't it? And that whole kind of, gosh, I actually have to carry on working. I have to carry on swimming. This isn't a kind of, I'd like to take 2 weeks off or whatever. It was about working with the issue, and interesting when allowing that to happen, really. And I think we can chalk this up as a reasonable success, and a sense of kind of, okay, so we're in a place where there's, you know, we're not clear, it's not all done, but there's a sense of where we're not carrying the same pattern. So now we can retrain and undo the pattern rather than just fall back into the pattern that we had before, which gives Kelly an opportunity to change her breathing routine or warming down, or a bit more kind of take on board some stretching, so that we don't fall back into that pattern of tight lower back pain, right hand glute issue. And we can move into something else, and that's you know, cool stuff, really. I think we can feel pretty pleased with you know, and interestingly, I think also it's about the client getting to a place of realizing, actually, if I'm not careful, be broken, and therefore, to stop that, I've got to kind of invest a little bit in looking after myself, and part of that is not just diet and exercise, but part of that is getting this kind of treatment, getting some stuff that helps to sort of soften tissue, and become more aware. And by awareness, we can take control of pain and take control of managing ourselves better. So I think it's a sort of it's pretty good, pretty good. Okay, you just come and turn over. Just hang on a minute. Let me do the towel management. I've been so good with the towel management. I don't want to mess it up in the last 5 minutes. Come and turn over for us, Kelly. These people, they turn over like flipping like pancakes, and you've got to be really quick with your towel management, otherwise you end up embarrassing yourself. You're right. And head above the hole. Brilliant. Let's just look at retraction, just see how those shoulders look. Yeah, better. Still forward? No? But much better, isn't it? And it feels nice and springy. Pretty much even. Oh, Mark's here. Let me introduce Mark. He's here. You just have a quick look at Mark. Here he is. Look. Mark. Yeah. Mark's here. Normally he's here on Zoom, but today he graced us with his presence, which is pretty scary, really. But he's. We thought for a while he didn't have any lower body, but he does. Okay, just going to do another technique. I want to do another technique on the hamstring because I quite like this one. And just bring the hand up and bring the knee up and just hold the knee for us, okay? And just do the towel. Let me do the camera so you can see what I'm up to. I've got to be a bit careful over here. We've got people that are doing stuff. Okay, that's cool. I just want to come in here and do this move, and I quite like this. So I bring the knee and she pushes up the knee and I stretch it. It allows you to get right up on top of, can you see that okay? Yeah. Allows you to get right up on top of the ischial tuberosity. Which is nice and it feels okay, doesn't it? It feels different. Okay, so to push your heel into my hand. And then relax for me, and then I'm just going to come up. Reasonable stretch. And then come back. And then push into your hand. Just move around a little bit. There. And then relax and take a breath in and then push through. How's that? On a 1 to 5? Better? Push you into my chest. Come on, push, push, push. And then relax. See what's happening with the pelvis. And I want to just see, where are we with the camera? Okay, good. I just want to see where we are with that sliding technique. So that one, it feels nice and easy now, doesn't it? And then this one. Tighter. Not as easy, is it still? Okay, so just turn over for me. Yes, please. Are you okay with that? Let's do the other one. So I want you to push your fingers into my hand. And then relax, take a breath in, and let me do the work. We'll do this hand. And push into my hand. And then relax. So here we're doing a straightforward bit of MET. Let me, if I can take that off, then you'll see what I'm doing. Okay, so I'll just ruin the town management there, Kelly. I was doing so well. I was chuffing myself. So hand round on the ASIS. Kelly then pushes her fingers down into the couch. So squashing that, and then I sit on this side of this. So here's a PSIS. I'm sitting on this side. Just relax for me. Take a breath in, and then I hold and I lift the vertebra up this way, the pelvis up this way. So I'm getting movement back on that joint. And then push down again. And then relax. Cool. And I'm just going to push down on the sacrum. And then we'll turn it back over again. That pincher slide is that kind of free up a little bit of tightness in that area. Oh, Kelly, this is all going downhill. Turn over for me. Which way do you want to go? Okay, so I think we'll pull this to an end now, and I think we can feel that feels good, isn't it? Not better. Just that little bit of SI joint tightness on the glute. I never know, you know, when we get to that place where we're working on SI joint, that we're using MET to really kind of engage it and move it around. It can work well by one hand being on the ASIS and pulling around and holding the sacrum, trying to get some rotation back in the pelvis, and that's worked really quite nicely on this occasion, which is good. So that pulls our treatments to a finish, and this series of 4 treatments for Kelly and her back. Much better. It feels completely different. And if I hold those 2 and push under here, they're level now, so it feels nice. And thank you for watching these. And I should keep it here as thanking Kelly for her hard work. She's been here for 4 Thursdays in a row, and bless her. So she put up with my humour and my general approach. But thank you for watching. And you know, feedback on these things is always helpful. Having a place where we can watch people work and integrate with that and plan and talk and share our ideas is what Thursdays is all about. But as I say, like all these sessions, they've gone onto our blog page as a series of 4 4 treatments, and I've always welcomed people's feedback and observations. Really good. But thanks for you, Kelly. You've been a star. Thanks for joining us. And okay, I'll say good night.